There is a compelling need in both health and economic terms to enact health reform this year. Our healthcare system is at a breaking point, with the uninsured facing extraordinary hardships, small businesses struggling to overcome competitive disadvantages, and taxpayers saddled with unsustainable burdens. We must change course. Just last week, the Census Bureau indicated there's been a 20% jump in the uninsured over the last decade, and it would have been much worse without an expansion of public programs such as Medicaid and CHIP. Health spending in the U.S. is twice per capita what it is in other countries. We're now spending 17% of the nation's economy on health care. It will grow to 21% by 2020 if current trends continue. Health insurance premiums are now 18% of family incomes, and they will increase to 24% by 2020 if we continue on our current course. Nor are we getting value for what we're spending. The U.S. ranks last on many indicators of health and quality of care. We must change course. As the President noted in his address, the goals of health reform are clear. Ensure the stability and security of health insurance coverage for those who have it, provide insurance for those who don't, and slow the rise in health care costs for employers, individuals, and government. The health reform provisions in H.R. 3200 as amended would go a long way toward fixing our broken health insurance system. According to the Congressional Budget Office, it would reduce the numbers of uninsured by 37 million people. It would increase coverage under the Medicaid program by 11 million, most of whom are uninsured now. The establishment of market rules, creation of an insurance exchange, an essential benefit package, and the provision for sliding scale premium and cost-sharing assistance would help those Americans who are most adversely affected by the current health system. CBO estimates that 30 million people would be covered through the exchange, most receiving some assistance, about 20 million being enrolled in private plans, 10 million in a public health insurance plan. The stability of coverage would be improved as people lose or change jobs or experience changes in life circumstances. In short, House provisions would ensure that no one becomes bankrupt from ruinous medical bills or struggles to pay medical debts arising from a serious illness. Health system changes in H.R. 3200 as amended would also improve health outcomes, quality of care, increase efficiency, and slow the growth in total health system cost. It includes investments in primary care. It establishes a pilot program to test new payment methods that reward quality and efficiency. It covers prevention and wellness and eliminates any cost sharing for preventive services in Medicare. Major new savings come from productivity improvement provisions and other changes in provider payment update, about $200 billion over 10 years, and correcting Medicare Advantage payment rates, about $172 billion over 10 years. It would slow the growth in federal health outlays from these Medicare savings provisions from 8% a year to 7.3% a year. The creation of the health insurance exchange and establishing a minimum medical loss ratio for health plans would also yield savings for businesses and households. Administrative costs for individuals would fall from 40% of the premium to 14% of the premium. Administrative costs for small businesses would fall from 15 to 35% of the premium to 12 to 14% of the premium. There's important provision in H.R. 3200 as amended that would review premiums that go up faster than 150% of medical inflation. If we had just held premiums to that rate over the last decade, premiums today for a family would be $2,600 lower. In fact, CBO estimates that a public health insurance option would have premiums 10% below those of private plans. We estimate from a plan similar to that enacted by the Ways and Means Committee, it would slow the annual growth rate in total health system spending from 6.5% to an estimated 5.6%. I should caution you that CBO has seriously underestimated savings of 3 major health reforms in the last 3 decades, and it's overestimated the costs, so we don't know these things with precision. But moving forward, it's important to carefully and thoughtfully phase in reforms, measure our progress in order to make any mid-course corrections that may be necessary. Congressional oversight will be critical. Congress should ask the administration to establish a system for tracking performance on major health reform goals, make recommendations on any additional policy changes that are needed, because if necessary, Congress can act in future years to modify reform, including phasing in various provisions more slowly or more quickly, or adding additional safeguards or savings. This is a historic opportunity to put our healthcare system on the path to high performance. The cost of inaction is high. The time has come to take bold steps to ensure the health and economic security of this country. Health reform is an urgently needed investment in a better health system and a healthier and more economically productive America. Thank you.
Thank you. Mr. Ahrensmore? I think your mic.
There we go. I appreciate the opportunity to provide the small business perspective